Okay, let's get into the meat of the interview. So, let's talk about things that you probably want to practice answering before you have your interview, especially your residency interview. Of course, you're going to have all of the typical things like, oh, tell us about a time that you failed, and you want to answer it in a very structured way, and this is why you want to practice. So, you want to list the scenario, you want to list exactly what the problem was, and then you want to explain why that was a problem for you, and then you want to explain why or how you solved it and how that scenario has helped you moving forward. So, anytime that you're having any kind of interview, whether it be a regular job interview, when they ask you questions about this, they don't just want you to give a scenario. They want you to have thought about that scenario, and they want you to show or explain to them that you have been implementing the improvements in that from that area in other areas of your life. So if you have a place that you failed, you want to say how the solution that you came up with has been able to help you in other areas, and bonus points if it pertains to the current job that you're applying for or the current residency spot that you're applying for. The next thing is you want to know how to answer these questions, and you want to also make sure that you're looking at the current climate, the political climate, and how that affects medical education, how that affects Medicaid, Medicare, and you also want to inquire from your interviewees, especially the chairs, the program directors, and if you get to talk with the dean in your medical school interviews, you want to talk to them about, and if you get to talk to anybody from the hospital who may be a chair of the hospital, ask them questions about the current climate. A good question would be, with the current passage, with the recent passage of the Big Beautiful Bill, how is this institution working to recruit more socioeconomically disadvantaged residents or medical students, et cetera, et cetera. This tells them that you've thought about how the current climate is going to affect medicine. You also may want to ask them, especially if they are clinicians and they're working in academic programs as well as private practice, ask them about how they are planning to work around the large Medicaid and Medicare cuts that are coming down the pipeline, and especially for pediatric anything, how are they preparing to still be able to serve children who may not have Medicare or Medicaid, as well as patients who may be undocumented. These are very important questions to ask because, especially in pediatric everything, a lot of those patients are funded by Medicaid. So you want to ask these questions, and you also, if this is something that's important to you, serving underserved populations, serving immigrant populations, and medical advocacy, these are the things that you want to make sure that you are aligned with. So you want to ask deep questions, but you also want to be able to answer those questions. So I encourage you to think about different scenarios, like if a patient comes in and they're undocumented, or if a child comes in and her parents are undocumented, or if a child comes in and they don't have Medicare, Medicaid, if a patient comes in and they don't speak your language and they are undocumented, what are some things that you would do? And you want to answer this in a way that is true to you and true to what it is that you believe, because you want to align yourself with a program that has the same beliefs and values that you have. So this is very important, but if you ask in-depth questions, it will show that you are serious not only about medicine, but whatever particular field that you're going into with regard to radiology or surgery or whatever, what have you. These are the questions that you have to think about when it comes to your specialty.